Okay, what you're seeing here is what we call the Your Home Health Agency card. Okay, so what happens is when you admit a patient, okay, what we like to teach people is this: you provide them with an ID card. So if you are running a company, you should actually purchase yourself your own ID maker, your ID badge maker. So I have this ID badge maker that I actually purchased, and it can make cards that, look just like driver's licenses pretty much. And so it's very, very thick. It's like a credit card. And what we would do is we would literally put the patient's name in there. We'll brand our logo on the top, as you guys can see, put the patient's date of birth, their sex, their address, their Medicaid, their Medicare number. If they have any private insurances, we put that there as well. Their current diagnosis, their primary care physician's name, the phone number of that primary care physician, and then we put the previous admissions information, like what hospital did they come from, what rehab center they recently come from, and then the home health agency that is working with them, which is of course your agency. And in the back of this card, what you're going to put is their current medications. And in that current medications, make sure put in the bottom as of what date that is what the medications are for. And you can put instructions. Please give us a call as if you need more information about this patient so that we can give you a full report. The reason for this card is this: patients will forget their social security number, their date of birth sometimes, their addresses, the name of their doctors, and so forth. And also, of course, the history of their medications and their diagnosis. So what happens is if a patient ends up in a hospital, they can give this with their ID card because you're going to make sure it's right next to each other. And what happens is now the hospital has the full information of the patient, which makes it easier for them to be able to do the admission. Plus also they have a list of the medications. One of the biggest problems of patients is that they get into a hospital, but the hospital doesn't have the most recent information on their medications, which would cause problems for that particular patients because sometimes the patients cannot remember all of those informations. But what's important here is that you have the name of your home health agency on the top. So no matter what, the hospital, the nursing home will see this information and they know that they will have to contact you because you are the home care provider. What this in turn can be used for your marketing purposes is you can show this to the hospital, you can show this to the nursing home, you can show this to the assisted living. Because one of the biggest things is when this patient goes in a hospital, you can tell the nursing home that they will have this information with them so that just in case the hospital doesn't know, that now they know which nursing home the patient came from before any of these services happens. So they will probably contact that nursing home, that rehab center, to let them know that the patient is going to be discharged and more likely will need to be sent to them. It goes the same exact way if the patient is in a nursing home. They're going to call you guys as well. The most important thing here is there is some cross assistance here. The nursing home will appreciate it because no matter what, they got a referral that they would have never had if the hospital didn't know. So it's a great show to a lot of the referral sources that you're trying to help each other out. The physicians, the hospital, the nursing home. Very good way to be able to market your company. You can go to a nursing home discharge planner and say, look, this is what we make sure that we actually, when a patient gets admitted to us, they have this card. And because they have this card, if they end up in a hospital, Mr. Smith, what's going to end up happening is the hospital will know that they previously stayed at your nursing home. So when they need to be discharged to a skilled nursing facility, they will have you as the primary company to call. So what we make sure is that the patient has continuative care, making sure that he is receiving care for people that are actually already aware of his information. So that is valuable to us. So hopefully when you have any discharges or you have one of our patients who has this card, you will call us to make sure that we handle the home health services of that patient because we're familiar with them. So it's a great way to actually show that you are willing to scratch other people's backs to make sure that they are actually getting their census up, and hopefully they can help you get your census up as well. Okay? So great. Listen, I want you guys to understand this. This is what we call marketing is a way to success, okay?